So thank you for having me. Charlie asked me to come on and talk a little bit about what are some of the things that are going on for the Children's Task Force this year. What are some of our initiatives and what's going on with children in Franklin County right now? And obviously, like you all, children are learning a new way of life, and it's affecting all of them from the infant toddler stage when they're learning to make friends and be with other people besides their own immediate family, all the way up to the high school level, which is where my son is, where he's all of a sudden not able to be social with his friends and interact in a normal teenage way, which I find very sad for him. Our agency, in response to COVID, really had to quickly pivot our services. All of our services were in the community and in person. The majority of our staff, it was in the schools, working after school in the after school program, working in the schools with social emotional learning, and our program that we call it PCABT, which is a Prevent Child Abuse Vermont model for sexual abuse prevention. I think the last time I was here at the Rotary, we had talked about the fact that Franklin County had just been identified as having the highest percent of child sexual assaults in the state per capita. And in response to that, we had undergone a pretty in-depth community needs assessment to identify some of the risk factors that were contributing to those numbers. And we identified and recognized that the after-school hours were very vulnerable times for students when parents were still at work and children were unattended at home or out being social, as children like to be. So the 21st Century Kids of Franklin was born out of that needs assessment. And we are very happy to announce that we are, as of this year, officially in every school in our community. We are at RSU 73. We are at SAD 58 and SAD 9, providing that after school time in person in SAD 58 and SAD 73. And via Zoom and remotely with RSU 9 currently. We are in varying years, year 5 for SAD 9, year 3 for SAD 58, of which Sue Pratt was instrumental in getting that, and year 1 in RSU 73. So we're definitely on the right track. We have seen numbers decrease pretty substantially in sexual abuse rates in Franklin County. During COVID, it's been interesting because we've also seen an increase in physical abuse of children in our county. And we are seeing educators have a look into the homes of their students. So we're seeing a big uptick in teachers and administrators reaching out to us asking, what do we do? Is this reportable? How do we educate our own staff? So I've been working with the state of Maine to reimagine mandated reporting in the times of COVID. Other pieces that we've done are community pieces. We had back in 2007, Lisa Laughlin and I started the Early Childhood Initiative, which was an initiative in Franklin County to help parents understand what they could do when in the community they saw abuse or neglect or uncomfortable situations happen. It has taken a very long time for those strategies to be put in place, but just this year, we launched what we call the Front Porch Project. And this is probably the project that I've been most excited about in a very long time. It is a hands-on training for anybody in the community to help them intervene in a situation that they see in a grocery store. If a parent is frustrated, angry. They can intervene in a church. They can intervene in a school setting with a parent and child in a way that is not going to endanger the child, is not going to put the caregiver on a defensive track, and help the child and parent to sort of de-escalate the situation. And it all really talks about when you were a child and reimagining when you were a child. When I was a child, I grew up my early years in North New Portland, and we rode our bike everywhere. And, you know, we played with the neighborhood kids. And if I did something wrong, every parent on the street knew about it. And all of them were okay with saying, stop, or we don't do that, or calling my mother and saying, do you know what your daughter did? They were okay with that. And we've become very siloed in our interactions with children, and we only want ourselves to be those eyes and ears of our children. And what it's done, unfortunately, is allowed sort of disintegration of community. And this training helps the population that is more confident and comfortable in saying, oh, I remember when my kids were that age, it was so difficult to bring them into a grocery store, to de-escalate situations that they see out in public. And the training really talks about what were those things in our childhood that we were comfortable hearing as a child from someone besides our parent, and what are those things that other parents would say to us to get us to know, hey, you got eyes on you, we're all watching you. You know, it's not just your parents that are responsible for you. We're all, as a community, responsible for each other. So this program was launched by us in January. We've worked really hard to get all of our education staff trained in it. And we've begun doing the training for various groups. We really targeted the groups to start because they are going to be our pilots. We've targeted some of our religious homes. We've targeted some of our graduating college students, and we have targeted some childcare groups and a couple of PTAs, so that we have sort of a broad range of people who are getting those trainings. And then the idea is to bring more and more people on that are comfortable intervening in situations they see in the community. We've also had to pivot and provide things to our parents that are referred to us who need education around parenting and support with discipline and behaviors. And everything has gone via Zoom. Everything is remote. It's been rewarding in that we have very large groups now, because it's really interesting when people can get onto a Zoom and shut off their camera and listen and take in the information and not have to put their face out there. That's something that we've really found that parents enjoy. They love using the chat features. They love asking questions of other participants, but not having people see them and their reactions. So it's really interesting how that has brought together more people who are now more comfortable reaching out for help and support. I think it's also given our educators new, interesting topics. One of the biggest support groups that we are having people attend right now is our Circle of Parents for parents and caregivers who are supporting children that are remote learning, and how parents are feeling so very inadequate around all of it. And I will tell you, I am that parent. I don't know the new math that they do. And I have a son who's in algebra. I don't know how they don't do sentence diagrams anymore. Never heard of such a thing. All of these things that I grew up with, they don't do anymore. And so trying to be that support person for your child or for any student and not having a clue as to what you're doing is a little intimidating. So we're really, we had 34 people in that support group last week. And it was pretty interesting, some of the things that they're doing, some of the strategies they're implementing to try and get their students where they need to be. Our home visiting program was a home visiting program. We would go into the homes of very vulnerable families all over Franklin County, from Jim Pond down to Livermore Falls. And we have had to virtualize everything to meet a national model that was not developed to be done via Zoom. So we are learning new strategies for helping families who may be experiencing domestic violence but can't talk about that because their abuser is in the home. We're having to figure out new ways to support families when they're not able to tell us what their challenges always are. And it's not always a partner that they're living with. It could be a parent that they're living with, and they're, a grandparent of our participant or of our babies that we're supporting. So it's been a real challenge doing that. However, I am extremely impressed by the fact that prior to COVID, we did 1,700 visits in a year with the families in Franklin County. And we are about a month shy of our 1 year pulling them out of the homes. And we've done 1,980 visits. So we were able to actually increase the participation with families. And I think primarily that happened at the beginning of COVID, when families were feeling so isolated and not having a lot of support systems there. One of the things that we are noticing, and I think law enforcement is noticing it as well, is there's a very big spike in substance abuse use amongst families. And it's some of them consider it coping mechanisms. Others consider it to be a way to alleviate the stresses of parenting, unemployment, housing crisis. It's been a challenge to support families remotely who are experiencing this, and making sure that they're following through with referrals that are going out. So all of the stuff that we've always done is still being done. It's just not at arm's length with them. And that has become a challenge for us. And we are always looking for new ways to engage with families, but COVID can't go on much longer because families don't have the capacity. Some of the more stressed families don't have the capacity to continue to feel that isolation. And I think that that's something that our community really, really needs to pay attention to. We have kids that are really struggling because of everything being remote and sports not being played the way that they are meant to be played. And it's hard. It's like that double-edged sword, keeping everybody safe and keeping their mental health the way that it needs to be. And so that's what's going on at the task force. We have had to cancel our children's festival and our father-daughter dances, and we're very sad about that. We are really, really, really hoping to be able to do an outdoor father-daughter dance this summer. So stay tuned for that. We are in the early stages of planning something, and it's all going to depend on numbers and what the governor says we can and can't do. But we're very hopeful that we'll be able to do something that's going to help get some of these families outside and together. So, yeah.
Any questions for Terry?
About 1 million, but I'll keep it to 2. First of all, one point is when you talked about the front porch project. I have 4 kids and just wanted to comment. I was with one of my little ones in the store who pitched a royal fit because she couldn't get what she wanted. And I held my ground and just said, no, this is what we agreed. And, I just let her have her fit. And a woman came up to me when things settled down and said, that was such a difficult thing for you to do. And, good for you for holding your ground. And that was about 1 million years ago, something, give or take. And I still remember it like it just happened. So it makes a huge impact. And I think it's a great project. And I look forward to seeing what happens with that. The other thing I have, my other question is, the period of purple crying, I used to knit purple hats for that 1 million years ago. I don't know if you're still doing that, or if so, if you can share some information about where to put those.
Sure. So yes, we are still doing the purple hats. It's called Click for Babies, where we get community members together who might be part of knitting circles or sewing circles. And we collect purple hats and we deliver them to the birthing hospitals in Franklin County. Obviously, that's Franklin Memorial. And all of the babies that are born in October, November, and December go home with little purple hats on to represent the period of purple crying, which is a period after the child is born that I'm sure most of you have heard of colicky babies, and it was always thought that continual crying from a baby at certain points was because of gastrointestinal issues or things like that. And what we actually know is that it's a pattern of crying that happens in some children. It's progressive. It's not easy to soothe. Many people look at it as a difficult child, but the reality is that it's very normal. It's a normal cycle of crying. And it is one of those programs that we started because of shaken baby deaths and injuries that were being seen around the state of Maine. And a CDC research project that went back and looked at the death records of all of the children that died under the age of 3, and they found lesions on the brains of more than 50% of them, and the lesions were from babies being shaken. So the period of purple crying was born, and we worked with the CDC and other groups, law enforcement, to bring that to the forefront. And so the period of purple crying was born. And now we partner with our birthing hospitals, and every parent watches a video and gets a book when they take their child home, so they know what to do when that happens. Put the baby down, put them in a safe place, stick them in a car seat on the washing machine, do whatever you have to do. Don't put your hands on them.
Mm-hmm.
Thank you. Dennis says,
click for what? I'm sorry, let me write it down. So what was the website? Click for
Babies.
Click for Babies. Perfect. Thank you.
Yep.
Yeah, Renee, just a question about your funding and grants and how that's been affected in this damdemic that we're in. So that just how you are coping with that.
Sure. So our funding has remained stable for the most part with our contracts, simply because we have been able to pivot quickly in what we're providing. And that really is not too much of a reflection on us. It's more of a reflection on the federal government and the state government, who was able to say, this is what new model fidelity standards are going to be put in place so that you can continue the work that you're doing. So our home visiting contract wasn't affected. Our after school contract wasn't affected. As a matter of fact, we just this week got the waivers from the Department of Education, so we can do school hour tutoring for students who are not engaging in instructional time at that moment. So what that means is if we have a student who goes to school Monday, Wednesday, but Tuesday, Thursday, they are home on their own with work that's been assigned, we can actually meet with them in that time period, one-on-one or in small groups to help them with the tutoring piece of it. So we're extremely excited about that. That's something that's just happened. We met yesterday with RSU 9 and RSU 73 has already implemented it. So we're pretty excited about that. Our Child Abuse and Neglect Council contracts, as of right now, have not been affected. We have a contract that's currently funded through the 30th of June. I would say that's probably the contract we are most worried about. Prevention is one of the most difficult things to measure. And unfortunately, right now, there's so many cuts being made at the state level because of this pandemic and the cost for businesses and otherwise, that there are going to be some cuts. And so we're just waiting to see what that's going to look like.
Thank you.
Yep.
Sue Pratt has a question.
So first of all, I want to say, Renee, thank you for doing all these services to the children of Franklin County. It's much needed, as you know, and for being able to adjust so quickly. I think it's critical. One of the things that I've been seeing a lot of is some newer opportunities for child mental health. And it dawns on me that some of the grants are going to be coming related to child mental health, which ultimately impacts some of the families around. So that may be a new funding source for you, but it also has started to really be a focus in the schools. We're all aware this is taking its toll on children everywhere. So.
Absolutely. And I don't know if you're aware, Sue, but we actually rolled out a social emotional learning initiative this year. We are piloting it in Strong this year and RSU 73, and also utilizing it in the after school program, because we just felt like these kids really needed something that was allowing them to emotionally connect with each other and with, safe adults in their lives. And you're right. The social emotional well-being of kids right now is just, it's paramount, and it has to be.
Yeah. Thank you.
Thank you, Sue. Dennis, did you have another question?
Yeah, I did, if I may. You talk about the silo environment now, as opposed to the neighborhood watch that we all grew up in, where right. Pop knew what I did before I did it most of the time. But I'm wondering what the role of respect is in this and in any program that you do to work with people, so that they respect somebody else or somebody else's opinion or somebody else's intervention. I mean, somehow I think that's all tied in together.
Yeah, absolutely. Empathy is the key to the Front Porch Project. Being able to put yourself in that person's shoes. You're not looking at them, you're not judging them, you're not sympathizing with them. You are in those shoes. So if we have, I'll give you a couple of concrete examples, Dennis. You're in the grocery store and you see a mom who is in pajama bottoms and a t-shirt, and her child has a dirty face and a onesie on, and he's thrown himself on the floor and he is having a temper tantrum because mama won't buy him that ball. You can sympathize and say, oh my God, that's so embarrassing. But that's not what that parent needs. That parent needs to know that it doesn't matter if they have on pajama bottoms and a t-shirt and their child's got a dirty face. That could be my kid too. So my responsibility as part of this Front Porch Project is to say, oh my gosh, I can remember when my kids did that. It was so embarrassing and I didn't know what to do. There's no judgment. You're putting yourself right there with that parent. They are not feeling defensive because you haven't said that they're doing anything wrong. Those are the strategies that we want to teach people in the community to use when they're engaging with others. It used to be, when I was a child, that if you lived next door to somebody, it didn't matter who drove what car. It just mattered that you were neighbors. And I think that that's something that we've gotten so far away from, that we are forgetting that we are all parents. We are all mothers, fathers, sisters, brothers, And it's very difficult to work in a society when you are by yourself. And there's a lot of things that have changed over the last 20 and 30 years. And that's one of the pieces that we are trying to eliminate the stigma of, is that you are not alone in this, that, you know, every parent has a kid that acts up in church on Sundays and wants to climb under the pews and pull the hair of the person in front of them. And so, you know, leaning over and, oh my God, my kids used to do that too. And I remember I used to think to myself, I'm never going to outgrow this phase. You know, things like that, where you're empathizing with the parent instead of pointing a finger, she can't control her child, or, oh my God, that's such a spoiled brat, or whatever. There's no judgment. It's just simple empathy.
So,
thank you.
Mm-hmm.
Chris Hollingsworth has a question.
I just didn't want Dennis to have all the questions. Actually, mine's not really a question. It's more of a statement. I mean, as Renee's mentioned, they've been working with RSU 73 for quite a while, and just thought it was important for people to hear how invaluable that's been for us. I mean, I think we're at the point now, they've been working with us for so long that if that were to go away, we'd feel like we were losing staff members, because it's just been a great bond between the school, especially at our lower grade levels. And they've helped out our parents quite a bit over the years.
Thank you.
Any other questions for Renee this morning? Well, Renee, on behalf of Farmington Rotary, thank you so much.